Explain about the composition and the function of blood. Blood is a specialized fluid in the body that play prominent roles in transport, immunity, and homeostasis. It is composed of plasma and form elements, cells and cell fragments suspended in the plasma. Of blood, first is plasma. Plasma make up about 55% of blood volume and is mostly water, about 90%, along with the protein like albumin, globulin, yeah, electrolytes, hormones, nutrients, and dissolved gases. Red blood cells, erythrocytes, normally account for about 45% of blood volume. They transport oxygen from the lungs to tissue and carry CO2 back to the lungs. White blood cells, leukocytes, make up less than 1% of blood. They are crucial and prominent role for immune defense against infections and foreign invaders. Platelets, thrombocytes, also less than 1% of blood. They help in blood clotting to prevent excessive bleeding when blood vessels are damaged. Blood plasma is the liquid yellowish and part of blood that carries cells and substances throughout the body. It makes up the about 55% of total blood volume. White blood plasma contains plasma is mostly water, 90 to 92%, plus proteins, albumin, globulin, fibrinogens for clotting, electrolytes, sodium, potassium, calcium, chloride, nutrients, glucose, आपका amino acids, vitamins, hormones and enzymes, gases, oxygen and carbon dioxide in small amount. Waste product, urea, uric acid, creatinine, and waste product, urea, uric acid and creatinine. Function of plasma: transport nutrients, hormones and waste product, maintain blood pressure and volume, supports immunity because plasma contain antibodies, helps in blood clotting, blood fibrinogen and clotting factors, maintains fluid and electrolyte balance, helps regulate body temperature. Plasma versus serum, very important. Plasma blood with clotting factor, serum जो है वो आपका plasma without clotting factor, so that is called serum. RBC is also known as erythrocytes. Red blood cells are specialized cells in the blood, primarily responsible for transport oxygen and CO2 throughout the body, made in bone marrow and that in spleen. Structure of red blood cells: RBC have a distinctive biconcave shape which increase their surface area for efficient gas exchange and allows them to squeeze through narrow blood vessels. They lack a nucleus and most organelles which maximize space for hemoglobin. The oxygen carry protein. The cell membrane is flexible and composed of protein and lipids, enabling RBC to maintain their shape and deformability as they travel through the circulatory systems. RBC, function of red blood cells, erythrocytes: oxygen transport. Hemoglobin in RBC bind oxygen in the lungs and deliver to tissue throughout the body. Carbon dioxide transport. RBC help carry carbon dioxide from tissue back to the lungs for exhalation, mostly as bicarbonate ions. Buffering. Hemoglobin act as a buffering, helping maintain the acid-base balance in the blood. Blood group determination. RBC carry antigens that determine blood group A, B, AB, O, and Rh factor, which are very important for safe blood transfusion. RBC are produced in the bone marrow and have a lifespan of about 120 days before they are broken down and recycled. Their unique structure and function make them essential for sustaining life by ensuring adequate oxygen supply to all body tissues. You can see in this image red blood cells. This is those बाइकॉन्केव शेप एंड रेड ब्लड सेल्स यानी प्लाज्मा प्रोटीन्स और आपका अदर जो मटेरियल है वो यू कैन सी इन दिस इमेज. Cells यानी WBC cells, leukocytes are crucial component of the immune system. They help the body fight infection and disease. इसका जो मेड जो बनता है वो भी मेड इन बोन मैरो एंड डेथ जो है वो आपका स्प्लिट में है. नंबर ऑफ WBC 4000 से 11,000 they are produced in the bone marrow and circulate in the blood and lymph tissue where they respond to threat like bacteria, viruses and other invaders. Main type of white blood cells, neutrophils, leukocytes, monocytes, eosinophil and basophils. Function and importance of WBC, white blood cells. So white blood cells defend the body by destroying harmful bacteria, creating antibodies and finding malignant disease. They are always on patrol in the bloodstream, ready to respond to any infection and injury. Abnormal count to high or to low can indicate underlying health issue and often checked during routine blood tests. Key facts क्या है? So what is key facts of WBC? So WBC have about 8% of total blood volume. Most type are produced in the bone marrow with some lymphocytes maturing in the thymus, spleen and lymph nodes. Their presence and activity are prominent for maintaining overall health and immunity. So you can see in this image your different types of blood cells. Neutrophils first to respond to bacteria or virus. Eosinophil known for their role in allergy symptoms. And basophil known for their role in asthma. Lymphocytosis fight infection by producing antibodies. And monocytes clean up dead cells. Clinical relevance. A normal platelet count range from 150,000 to 450,000 per microliter for blood. Abnormally low platelet count, thrombocytopenia, increase the risk of bleeding, while high counts can increase the risk of clot formations. Platelet level are often checked to diagnose and monitor various blood disorders. Thrombocytes are prominent and essential role for maintaining vascular integrity and are a key components of the body natural defense against blood loss. Third is thrombocytes, platelets. Known as platelets are small disc-shaped cells fragment in the body that play a crucial role in the blood clotting and preventing bleeding from injured blood vessels. Structure and origins. Thrombocytes are not true cell because they lack a nucleus and organelles. They are produced in the bone marrow from large precursor cells called megakaryocytes. These fragments are about 2 to 4 micrometers in diameter and circulate in the blood stream for approx 8 to 10 days. Functions क्या है? What is the function of thrombocytes? The main function of thrombocytosis is hemostasis, forming clotting at the site of injury to stop a slow bleeding. When blood vessels are damaged, platelets adhere to the site, aggregate and release coagulations factor to help from a stable clot. They also assist in wound healing by providing a foundation for new tissue formation. You can see in this picture thrombocytes या platelets. So you can see in this image structure of thrombocytosis, vesicles, microfibrillae, granule, glycogens, open canicular systems, mitochondria, small vesicles, large vesicles. So these are structure of thrombocytosis. What is the function of thrombocytosis? Blood perform several vital functions in the human body, primarily centered around transport, defense, and regulations. Transport functions. Blood carry oxygen from the lungs to all body tissue and removes carbon dioxide for exhalations. It also transports nutrients such as glucose, amino acids, and fatty acid to cells and deliver waste product like urea and uric acids to organ like the liver and kidney for eliminations. Defense functions. Blood role a prominent role in the immune systems by circulating white blood cells and antibodies that help fight infection and disease. It also help platelets and clotting protein that help clot to prevent excessive bleeding when blood vessels are damaged. Regulatory functions. So what is the function of regulatory? So blood help regulate body temperature by absorbing and distributing heat throughout the body. It also maintains the chemical balance, and water consists of tissue through buffer and osmotic pressures, ensuring hemostasis. What is function of blood? Blood is a connective tissue. Transportation carries oxygen from the lungs to body cells, transports CO2 back to lungs, deliver nutrients from digestive system to tissues, moves hormones from gland to target organs, removes waste product to kidney, lungs and skins. Regulations help maintain body temperature, regulate pH, acid-base balance, maintain fluid and electrolyte balance. Protection, defense. White blood cells fight infection and microbes. Antibody provides immunity. Platelet and clotting factor prevent blood loss during injury. Hemostasis, keep the body internal environment stable. Support tissue repair and healing. Transport of heat and enzymes. Distributes heat throughout the body. Carries enzymes and chemicals required for metabolism. Okay, thank you so much.